My first week of recovery was actually pretty easy. I resumed normal activity the very next day. Actually rode my bike to the gym and worked out. If I would have needed to go to work, I could have returned to work within the next few days. It was a lot easier and better than I expected. I wore my compression garment for approximately 6 to 8 weeks. The surgical garment I wore for 6 weeks, and then I went into a Spanx type of garment after that. And it was pretty much upon the recommendation of Dr. Castor and my follow-up visit when to transfer from the surgical garment into the Spanx garment. I noticed improvement in my figure pretty much right away. The love handle area and my sides seemed to be improved right away. I was very surprised. But then the rest of my shape started tightening up as the weeks and now months have passed by. I still am seeing a tightening effect. I would definitely do the procedure again, and I would recommend it to my friends, family. I already have recommended it to several people. Definitely, I would do it again in a different area of my body. I feel that having GPS lipo in the office under a local anesthesia is much better than being put to sleep. Um, it's so much more convenient having the procedure done in the office. I left, I was back on my feet the next day. Cost-wise, it's more cost efficient to do it in the office. Um, just less risks, and definitely glad I did it in the office versus at a surgery center. I did a lot of research on GPS lipo control before having my procedure, and I like the safety and accuracy of the GPS lipo, the mapping system in the machine. It helps Dr. Castor to know exactly where to target the unwanted fat and where not to go with the probe. So I just felt the safety of the mapping device on GPS lipo control versus traditional lipo was definitely for me because of just the safety and the accuracy that it provides. One thing I liked about the GPS lipo control versus traditional lipo was it wasn't quite as aggressive with the back and forth prodding movement of the probe due to the mapping system. It just seemed like a smoother, easier procedure, whereas the mapping explained and instructed my surgeon exactly where to remove that unwanted fat. And there just wasn't that ramrod use. And I just felt that that was a better procedure for me. I chose Dr. Castor because he had done previous surgeries for me in the past. I'd had breast augmentation done and had outstanding results with that, along with several other of his patients I've seen results on. I'm very happy and to report that my lipo procedure was a huge success.